What is kyphosis posture?
Kyphosis mainly affects the thoracic spine. It usually occurs when the front of the thoracic vertebrae gets deformed or crushed, causing this part of the spine to excessively bend forward. Kyphosis typically results in a rounded back in the thoracic spine, which looks like a hump in the upper back.
The normal spine is not perfectly straight when viewed from the side. The thoracic region has a normal forward curvature, ranging from 20 to 50 degrees. Kyphosis occurs when the curve in the thoracic spine exceeds 50 degrees.
Symptoms of kyphosis.
The most prevalent symptom of kyphosis is a rounded upper back. The exaggerated curve in the thoracic spine results in a humpback appearance. In addition, kyphosis can cause severe pain in the upper back, especially with movement. This is due to compression of the spinal cord or its nerves. Kyphosis often causes loss of mobility in the spine because of intervertebral disc degeneration. Spinal kyphosis and immobility of the thoracic region can cause forward positioning of the head, when compared to the rest of the body. In severe cases, kyphosis can cause compression of the lungs. This can result in chest pain and difficulty breathing.
Common characteristics of kyphosis: rounded back with greater thoracic curve. Shoulders slouch forward and the scapula are in protraction. The head tilts forward. Thoracic rigidity or stiffness, mainly in extension and rotation of the thoracic vertebrae. Chin up. Scapular protraction because of the shortening of the pectoralis minor. When the deformation stems from a structural source, it is more prominent when lying down. The chest muscles, pectoralis major and minor, are short. Short hamstrings.
Causes of kyphosis.
Osteoporosis, which commonly occurs in postmenopausal women, can cause compression fractures of the vertebrae that can then lead to kyphosis. The intervertebral discs, found between the vertebrae, act like shock absorbers. Disc degeneration due to aging can cause kyphosis, as the discs dry out and shrink. Cancer or metastatic processes in the vertebrae can cause severe deformities that may result in kyphosis. Postural kyphosis most commonly occurs in teenagers due to unhealthy sitting positions.
Type of kyphosis.
There are a few types of kyphosis. First, there's postural kyphosis, which arises from repeated poor posture, like slouching for a long time. Postural kyphosis is most common in young females. Second, there's Scheuermann's kyphosis, which is when the vertebrae get structurally deformed and become wedge-shaped for an unclear reason. This is often associated with scoliosis, and it's referred to as kyphoscoliosis. Lastly, there's congenital kyphosis, which develops when the vertebrae get deformed during fetal development, resulting in a baby that's born with kyphosis. In general, if the condition is severe, it can reduce the space in the thoracic cavity, which can compress the heart and prevent the lungs from fully expanding.
Treatment for kyphosis.
Your upper back is rounding because you're on your cell phone and computer all day. If not corrected, this will only get worse, leading to a number of different issues down the line. So let's take action now and prevent it from getting worse. Here's something you can do to help. Elevate your legs 90 degrees. Interlace your fingers, straight elbows, drop your hands overhead. Perform one set of 25 reps to improve your rounded back.
It's my curse.
Literally. I can't take this off ever.